As the name stands, part of faculty that teach the BDS students. Okay. A background, the context. Makerere University College of Health Sciences was created in 2007. We have tried to gradually change our teaching and learning system. So we adopted the PBL system in 2004. Actually, I was still a student then, though I did not go through that system. And then we reviewed curricula after that in 2009. Hence, we adopted the competency-based education, which has been in implementation for 3 years now. So some of the courses, some of the programs include dental, medical, nursing, radiology, and a number of other courses. Now, with the background that we had to change our system to competency-based education, I must point out that there's still quite an amalgamation of a number of things. So we still have the problem-based learning, we have the lecture-based, we have clinical teaching, and always it's an amalgamation of so many approaches. So these are some of the competencies that were picked after the curricular review. I will not go through the details. Now, dentistry is a 5-year program. And our curriculum spirals from the simple preclinical, where we have the basic sciences like anatomy and physiology. Then in the 3rd year, the students are exposed to the dental courses, but the preclinical courses. And then in the final years, they move to the more complex clinical courses. And I think that is a practice in a number of universities. So this particular innovation is in the 3rd year group, which is in that transitory phase from the basic sciences to the dental courses. And the course in question is oral medicine, which is mainly preclinical, although it has a clinical part to it, but it's preclinical in this setting, and then it's meant to be lecture-based according to the curriculum. So this was an innovation, and in line with the competencies that are supposed to be achieved in this course are knowledge, okay, critical inquiry, where we expect students to be able to do research on their own, critique journal articles and that kind of thing, then professionalism and ethical practice, then interpersonal and communication skills. So some of these competencies have students are exposed from their very first year, like interpersonal and communication skills, as well as knowledge. Then as they go on, keep on building till the final years where they're exposed to the patients, and that's when we expect them to have the clinical patient care skills. So why was this idea necessary? Basically, with the paradigm shift from the traditional teacher-centered to where we have students learning, deciding what they want to learn, and facilitating where faculty are facilitating learning, we're encouraging our students to be active learners. Therefore, there's necessity for also innovation in our delivery methods. We cannot keep doing the old traditional methods, and yet we're saying there's a paradigm shift. And also, with many of the presenters have already talked about this. Still, in the new day where we have ICTs and e-learning has been developed, it is only inevitable that we'll have to include some of these in our teaching and learning. Therefore, this was a pilot under the EAHPEA. We're trying to see how do we incorporate e-learning. So how, if we did, what would happen, and make an evaluation before we know whether we can actually take it on full force. So what was done? One, this is a blended, for the oral medicine course, we used a blended approach where we had both face-to-face sessions and e-learning activities. Therefore, it wasn't a typical e-learning course where you do not have an interface with the faculty. And the course was divided into 7 themes over the 14 weeks in which it was covered. And the e-learning activities were developed on the Mwesigwa platform. That is one of the platforms. I hope we're familiar with what e-learning platforms are. So this is Makerere University e-learning platform. And then there are 11 third-year students who are all automatically enrolled for this course and also trained to use the platform. So also among what was done, we had the weekly OVLs, overview lectures, as well as weekly instructions given to students on their online activities, as well as within the face-to-face sessions. That's when they would get the overview lectures on whatever theme that was carrying on over the next 2 weeks. And among the online activities, we had online asynchronous discussion forums. So asynchronous is where students go online and can have a discussion, not necessarily in the same time. So one may do it this evening, another one tomorrow, respond to what someone said the day before, as well as the faculty responding to whatever whoever has discussed. And we also had weekly group assignments, so the students were put into groups and they had to upload some of these assignments onto the platform. We also had online assessments. So for the face-to-face sessions, we had, since we encouraged interactive sessions, active participation, active student learning, it's actually the students that make presentations with the faculty facilitating. So this is the course home page. Just took a snapshot of the part of the home page. Okay, you can see oral medicine instructor and whatever goes in the design. An instruction to download the course description. So from the very start there was a course description, but also the students had to go back and download this course description. And then this is also a snapshot of an example of one of the online discussions that they had. I pointed out a number of the competencies that, apart from knowledge, would want students to have critical inquiry, professionalism, and ethical practice. So for example, this was one of those questions which was posed to the students, not necessarily a knowledge-based question, but more to do with ethical or critical inquiry. So it's just highlighting students' responses as well as the faculty. Then this is also a page indicating the very first online quiz that they had. Okay. And then the students, we had a challenge. Normally with online or e-learning, students can have their quiz done whenever, access it anytime and at whatever location. That would be the ideal. However, we wanted to minimize stealing of exams and copying and open book examinations, so we actually got them together in one room. So they had access to some of the computers there, so they had access, and then you can see one of them decided to carry his laptop, but basically they did it within one room. Okay, we designated a time when they used to come. So what are the outcomes? The online discussion forums augmented a number of student competencies. So these ones were not really meant to be knowledge-based discussions, but more to encourage critical inquiry among the students, so they would go and critique journal articles and come and report back during the online discussions. Then there were some questions posed on professionalism and ethical practice, what is their perception and that kind of thing. However, also through those discussions, there was definitely written expression, which is an important communication skill, as well as chat room etiquette. Okay. And then in the face-to-face sessions, some of the skills were also enhanced, and especially the communication skills, because the students have discussions, interactive discussions. And among the benefits, we have noticed that this innovation has enabled students to acquire competencies through use of relevant and interesting means, that is using ICTs, while at the same time encouraging students to be active learners, so they can actually decide when. I mean, whenever they're given an assignment, whenever they're given online discussion forums, and as long as they're given guidance, they actually go back and do their work, and then they can report back. And they are the ones who decide how to learn it. The most to do is facilitate and guide them to look in whatever places they have to do, but basically they have access to the internet and to know how to do it. It's up to them to know how to get to whatever they have to learn. And also because they had groups in which they had to do the assignments, this encouraged teamwork. which is very important as future healthcare professionals. And it also encouraged them, it gave them confidence as self-learners. Challenges, I would want to know how KCMC does this, but elsewhere, for example, in Makerere and in Ghana in general, we generally have poor internet access. Internet was on and off, so that became really a challenge, which also forced the faculty to adjust some of what I had planned in order to fit in with whatever resources were available in terms of internet access. And also the students are doing a number of other courses, so there's competing interests. Sometimes they're overwhelmed with the work from other courses. And then also there's, we have to develop a culture of, and a discipline. To use online learning, you need a culture and a discipline, which was one of those big challenges. So in their own words, the students thought, actually one said that this is novel and interesting, and thought that we should have been doing it since our first year. And then another said all lecturers should be trained to use Mwele. They should be able to even upload their lectures. And then another said, this would even be more interesting if you use the user-friendly social media for discussions like Facebook. Actually, it's quite interesting. When you get to social media like Facebook, it's natural and more prompt for students to participate. So recommendations, we need to embrace ICTs and e-learning as one of those delivery methods that inevitably has come if we have to move with the times. Then there's definitely need to train faculty as well as support teams, and then also to build sustainable infrastructure. Sustainability will always be an issue. And also we need to learn, as teachers, we need to learn to be accommodative and innovative, and probably we have to utilize some of these social media platforms.